Faculty of Dentistry, University of Malaya, is the foremost premier and oldest dental school located in southwest Kuala Lumpur, Malaysia, and was founded since 1905. Here they are well renowned for their highly equipped technology for research. For preclinical sciences, there are two research departments divided as the Craniofacial and Molecular Biology Research Lab and Biomaterial Research Lab, which focuses a lot in the prevention and etiology of oral cancer. The Dental Research Unit focuses in the study of histopathology and the abnormality of human tissues and DNA. There are two compartments, the wet lab and the microscope room. The Postgraduate Dental Technology Laboratory is where all the lab works are fabricated, such as maxillofacial prosthesis, orthodontic appliances, dentures, surgical spins, and crown and bridges. The first clinic we observed was the Postgraduate Pediatric Clinic, located on the third floor of the Postgraduate Specialty Clinic building. The lift arrives directly to the reception area outside the Pediatric and Orthodontic Clinic. In Malaysia, due to their conservative religion, there is a strict dress code the patients must comply to before entering the dental clinic. Inside the Postgraduate Pediatric Clinic, there is a playground and waiting area for the parents to wait with their children. The queuing system is logged into a computer where the patients will receive a queue ticket number upon arrival at the clinic. Every day, there is always one doctor on call for emergency cases, for example, trauma patients. Most of the patients here have complicated treatment plans or patients with a medically compromised disease. In the PG clinic, there are 10 dental units with 1 to 2 professors overseeing the postgraduate students. Similar to the pediatric clinic at Mahidol, the postgrad students also use behavior control techniques such as distraction, counting, rewards, praising, and voice control. Another technique used for very small children or uncooperative children is having the child securely supported on the parent who is the one sitting on the dental chair. This technique allows the dental treatment to proceed smoothly, efficiently, and safely. At the undergraduate dental building is where the fourth-year students treat pediatric patients. At the Dental Faculty, University of Malaya, dental students start treating their pediatric patients during their fourth year. The cases required to complete include SSC, fillings, extractions, treatment planning, and sealants. In Malaysia, all patients under the age of 16 must see a pediatric dentist. A pediatrician here is also responsible for fracture cases, tumors, soft tissue lesions, and phenectomies. At the Postgraduate Orthodontic Clinic, we observed cases such as orthodontic decompensation before maxillofacial surgery and cementation of fixed orthodontic appliances. We also had the opportunity to practice the IoT and dental health scoring with StudyCast, as well as treatment planning and assessment on dry cases. Postgraduate students here mainly receive fixed orthodontic cases or very complicated removable appliance cases. A lot of the fixed orthodontic cases come from undergrad students after completion of their removable appliance cases during their 4th and 5th years. Undergraduate prosthodontic clinic, we observed the third-year students doing removable partial denture cases. Likewise to Mahidon, the students here are also required to complete at least 2 complete dentures and 3 removable partial dentures. All removable dentures start since the 3rd year, while fixed prosthodontics start at the 2nd semester of the 4th clinical year. All the prosthodontic lab works, for example custom tray fabrication, wax up, masking and packing of acrylic, and teeth setup are required to be done by the students and not be sent out to the labs. The next clinic that we observed was the postgraduate periodontal clinic. At the postgraduate periodontal clinic, we observed the periodontitis case being treated by the guided biofilm therapy. Guided biofilm therapy is believed to be a minimally invasive technique that reduces the need of hand and ultrasonic instruments. It is supposed to be safe, effective, and gentle to the teeth, soft tissues, implants, and restorations. The first step is to assess the patient by caries risk assessment, probing, and screening. After assessment, the biofilm is disclosed with plaque staining solution to guide the removal of the biofilm during tooth cleaning procedures. The third step is the use of the airflow instrument with powder to remove newly formed plaque and calculus. Airflow can remove biofilm and early calculus in one single procedure. The airflow powder has the ability to easily reach the sulcus areas and interdental spaces. It is believed to be less abrasive than the traditional mechanical debridement techniques. Next, we observe the undergraduate students treating their periodontal cases. When receiving a new patient, the first step is examination, diagnosis, and treatment planning. Here, all the periodontal sharding such as recession, pocket depth, furcation, mobility grade, and plaque score is recorded electronically on a computer. At the oral maxillofacial surgery clinic, we observed undergraduate students treating extraction cases. The undergraduate students start extraction cases during their 4th and 5th clinical years, completing about 5 extractions per year. For minor surgery, the students must complete at least 1 wisdom tooth surgical removal case. We observed a case undergoing incisional biopsy of the tongue in a 75-year-old male patient with a symptomatic depapillization of the anterior dorsum of the tongue. The dorsal surface of the tongue had smooth areas of depapillization with no ulcers, no rolled margins, or signs of infection. The differential diagnosis for this case was geographic tongue, traumatic scarring, and epithelial hypoplasia. A biopsy was done to send a tissue sample for final diagnosis by the pathology department.